Hello ladies and gentlemen, welcome to this channel again. This is a channel that has to do with the health and health related issues. If you are new to this channel, please consider subscribing and hit the bell icon notification so as to be notified as soon as I drop a video, because every week I drop 2 to 3 videos related to your health. Last week we discussed about health liver diseases. Some types of liver diseases we said we have two: liver infective and non-infective, and under the infective we have hepatitis A, hepatitis B, hepatitis C, up to the number of the hepatitis virus we have. So by today we'll be looking at solely on why hepatitis B is 100% is contagious, highly contagious than any other viral hepatitis. We'll be looking at this in our subsequent lesson. Okay, let's now briefly discuss what is called hepatitis. Hepatitis is simply the inflammations of the liver. That is why inflammations of the liver. This is the inflammation or swelling liver. That is referred to as hepatitis. For instance, if you hit your head, if you hit your leg and the place got swell off, that swelling is referred to as inflammation. So when the virus hit the liver tissue and the liver tissue now reacted by swelling off, that is referred to as hepatitis. I hope you understand. This is the hepatitis inflammation, while these are the advanced level of the hepatitis. When this one is not tackled very well, it can lead to this one, cirrhosis, then it can lead to hepatocellular carcinoma. So we've discussed that in our previous lecture. If you don't watch the lecture, please hit it at the top. You will find it very interesting. Now let's move on. Then this is the topic proper: why hepatitis is highly contagious. Why hepatitis B is highly contagious. Okay, now these are the reasons. First of all, it survive outside the body. Secondly, that is outside the body fluid. We have different body fluids. We have CSF, that is cerebrospinal fluid. We have saliva. We have blood. We have sweat. We have vaginal fluid, semen, and others. So we will see whether this hepatitis B virus is infective in our body, in the body saliva. My next lecture will be on the comparison between the hepatitis A, B, C, or the HIV, plus whether the hepatitis B is infective in the saliva, body fluid, especially saliva. It can live in the dry blood. For instance, when there's a splash of blood, or when there's a blood outside the body, and that blood is infected with the hepatitis B virus, then hepatitis B virus can live inside that blood, outside that blood, inside that blood for a very long time. Takes days. Look at it. It's lived outside the blood, outside for 7 days. Imagine how infective this thing. Most of the virus, when they are outside the blood, they die. Especially the hepatitis, what do you call it? The HIV virus. So it's found in the saliva. As I said it's found in the saliva, but we'll see whether it's effective or not. Now let's move on. Then ways to contract it. Where are the ways in which one can contract it? There are different ways, but let's analyze these few ones. Let's contract it by the infected blood. That is when the blood is becoming infected, and you become in contact with the blood, and you have your communication between the blood and your body. One can contract it, and there is a transfer mother to child communication. That is from mother to child communication. Maybe during breastfeeding. No, not during breastfeeding. Process of delivery, or process of primitive life. That is when the the baby is in the womb, or we call it transverse communication. Then prick, then body prick, being prick. Then intimate contact, intimate relationship. When you become intimate with somebody, for instance, boyfriend and girlfriend, when they're too intimate and one is negative, one is positive, and because of the intimacy, one can infect the other one. So with the last but not the least, oral, vagina, and anal sex. These are the common routes in which one can contract hepatitis B. Let's look at these pictures. This is a mother and the baby at home. Mother and the baby at home. This is the mother, and this is a pregnant mother. And if the pregnant mother is negative, is positive, and she did not deliver in the hospital, there are tendency of her to transmit the virus into the baby, especially during delivery. That's why it's advisable to deliver in the hospital, because after delivery there's a drug, there's an injection that has to be given to the baby. And then this is the intimate relationship. As I said earlier, when a boyfriend and a girlfriend become intimate, one can infect another. And this is the oral sex. As I said, look at this. He's trying to satisfy his woman orally. I don't know why women like oral sex. They know better than we do. Then this is people at risk, who are at risk to get these infections, especially people in the healthcare industries. People working in the hospital setting, they are at risk. And people, look at them, and people undergoing chronic condition, people with dialysis, that is people with the kidney issues, especially people that undergo dialysis. They are at very risk of contracting this problem. So if you are new, as I said, if you are new to this channel, please consider subscribing and hit the bell icon notification so as to be notified as soon as I drop a video. If you are tested negative and you are on treatment and you are looking for ways to boost, to bring back your healthy liver, please hit the link below, hit the link down below so as to get yourself the right product. Now, this is the end of today's lecture. Please consider subscribing and hit the bell icon notification so as to be notified as soon as possible. Bye for now.